The Ontario government was forced to confront a major mix-up a little bit earlier. 700 COVID-19 positive cases went unreported to public health officials starting back in April due to a mix-up between two hospitals. And it means thousands of people who had been in contact with those patients weren't traced and notified by health officials. That work is happening now after the mistake was discovered. Premier Doug Ford was asked whether the issue was behind a recent rise in cases. He says that spike, though, is because the province is testing more people.
We have 10,000 tests, and all of a sudden the numbers drop to 280, people infected. All of a sudden we ramp that up, we'll almost double it to 18, 19,000. Naturally, the numbers are going to go up. So what we really do is we measure percentage. And right now, I think the percentage is 2.9 if we look at it. So we're under 3%. It's going in the right direction. And tracing, we're ramping up the tracing, working with some incredible companies. I believe Shopify, Canada's #1 company now, some of the brightest people, as far as I'm concerned, in the world at Shopify. They're helping us on the tracing side as well. So we're doing everything we can. We're building stronger systems right across the board. And every day, as a province, we're getting stronger and stronger and stronger in all areas.
So from a healthcare perspective, is Ontario's COVID-19 response getting stronger, or are there still gaps in the response? Dr. Michael Warner is the medical director of critical care at Michael Garron Hospital. He joins us from Toronto. Hi, Dr. Warner. Good to see you again.
Hi, Ashley.
So what was your reaction when you heard about this mishap between the hospitals and all these cases that basically went without any contact tracing?
I think like most Ontarians, I was disappointed to hear the news. But for me, it's just one example of the gaps that exist in the contact tracing infrastructure that need to be corrected right away if we're going to move forward as a province.
Can you outline for us what those gaps are from your perspective?
So right now, when a patient gets tested for COVID-19, it can take several days for that test to be resulted. So there's a time lag there. And there are no integrated information systems between the labs in the province and the public health offices. So they rely on fax machines, which is 1980s technology for a 2020 pandemic. And public health offices are getting a bunch of faxes all at the same time, which they have to then sift through and then decide who to call first. Keeping in mind that contact tracing, at least in Toronto, only happens 12 hours a day. And the government has given the public health offices a target of contacting 90% of cases within 24 hours. So if we add up all that time, it's a lot of time lost where community spread could be occurring because patients don't know that they have COVID-19.
Is this the only way to do it? Like, as you describe it, I think a lot of people are thinking to themselves, wow, it sounds pretty antiquated, right? Like, we've got to wait for this result, then we've got to call the people, make sure they pick up, who even, answers their phone anymore. We're all texting each other. You know what I mean? Like, I know there's lots of discussions about apps, but like, are the discussions about how to improve this process happening at the rate they should be?
I don't really know. And I have to be honest with you, I find it completely shocking that we have this system. So public health is dealing with antiquated technology. They've been underfunded for years, but we need to fix this now. It's simply not good enough to say that we have a strategy and that we're going to start to do something and we're going to rely on Shopify. I think Ontarians need to know what's happening today. We need to make sure the process is mapped out and that the pain points and rate limiting steps are identified and that they're fixed. Because if they aren't fixed, the efferent arm of having a positive test is essentially cut off. The positive tests are very useful information only if contact tracing occurs in a timely manner. If it doesn't, then we're relying on negative tests for our information. That's just not good enough to get ahead of this.
You also mentioned something on Twitter that stuck out for me in that contact tracing should include social workers. What did you mean by that?
When I think about all the patients who I've cared for with COVID-19, only one of them was born in Canada. 99% of them live in apartment buildings. Nearly all of them are living at the poverty line or somewhere thereabouts, and they all live in apartment buildings. So if you're going to give people advice to self-isolate, you have to make sure that that advice is actionable. How can people leave their apartment if they're taking care of their parents or their children, or if they don't have food, or if they don't have friends or relatives? We need to make sure that people are given the resources to follow the instructions that public health is providing. The return on investment is significant for the public because that will decrease transmission. It's also the right thing to do.
Yeah, and on that, I wanted to get your perspective because it's part and parcel of the discussion that we've been having on this side of the border over the past week, insofar as the Prime Minister remarked a couple days ago of the nearly 100,000 cases. There's barely any information even on the age of those cases, much less disaggregated data around race, for example, or socioeconomic factors. Is that a problem, and why?
It's absolutely a problem. We need to make sure, socially, that we understand who's being affected by this. And my sample size is around 50. And as I said, one of those patients is born in Canada. Almost all are new Canadians. Almost all are potentially in racialized groups, if we're going to use that term. And the social determinants of health, like income, housing, et cetera, are not optimal for these patients. So we need to have that data. It also could help inform the scientific community because perhaps there's some genetic predisposition that could lead to more effective therapies. So this data can only help us. If we're blind to it, it's not going to help us, and we should be collecting it, obviously in a sensitive way, but it needs to be done. It needs to be done now. And
I know a lot of that falls to provinces. Does that underscore for you, again, I guess, sort of the nature of the public health response and sort of some of the improvements that we need to be implementing soon, but also talking about in the future?
Well, we don't really have a public healthcare system. We have 34 individual public health units that are not integrated with respect to sharing staff, technology, or knowledge. At the same time, the COVID-19 pandemic in Ontario is essentially a Greater Toronto Area pandemic with some other pockets in areas that have disadvantaged people, to be honest. We need to make sure resources from the areas that are doing well get shuttled to the areas that are in need. That means people, that means technology, that means expertise and sharing of experiences. That's the only way we're going to get ahead of this. We can't rely on the provincial government to allow public health to start doing things when they feel it's politically palatable. We have to be innovative. We have to be proactive to get ahead of this.
What do you think about the prospect of a regional approach to reopening?
I think a regional approach has to be carefully thought through, but I think it makes sense. Kingston has been wildly successful in essentially eliminating COVID-19 from their population. Having gone to Queen's for medical school, they have a great hospital. We can provide non-COVID healthcare in that hospital and other areas like the north. We have to make sure we keep in mind how people are traveling between jurisdictions, but there also may be elements of the economy that can open up. This is not a pan-Ontario problem. This is a regional problem, which the postal code data reflects. And we need to make sure that we have a strategic response to reopening and also a strategic response to the public health attack on this virus.
And we've been checking in with you throughout this pandemic, partly because not only for the insights that you just brought us, but also because you are actually dealing with patients. You are actually in the hospital, which is so much of why everyone was doing all the physical distancing and complying with the restrictions, because we wanted to make sure that hospitals like yours weren't overrun. What is the latest perspective you can give us on what things are like for you on the front lines?
So within the hospital, the situation is much the same, where we're able to care for the COVID-19 patients within our resource envelope. But I must say, and this is for your viewers, the physical distancing, the social distancing, the wearing a mask, which I think should be mandatory when you can't physically distance, we cannot stop that. That's part of why we're having over 400 cases a day. It's not just that we're doing more testing, it's because the cases actually exist. So the people need to do their part, and then the government needs to do their part. Only by both groups doing their part together can we move past this. I'd like to start providing more care to patients without COVID-19, because I think people are going to start to die because they haven't been able to have access to care. And we can't lose sight of that in the death count from COVID-19. So we're still very much in the thick of this, and I haven't seen the proactive steps or the planning that I need to see to be reassured that the future is going to be any different from the past.
Okay, I'll leave it there. Thanks as always for your time and your perspective, Dr. Warner. Really appreciate it.
Thanks for having me.
Dr. Michael Warner joins us from Toronto. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.